Hello everyone, thank you for joining us today. It is Crista Carrion and Priscila Velazquez, and we'll be presenting our systematic review on the effect of exercise interventions on blood pressure in adults with hypertension. The goal of this review was to analyze the effectiveness of exercise as a non-pharmacological intervention for managing hypertension. Hypertension is one of the most prevalent and dangerous chronic conditions, affecting over 1.28 billion adults globally. It significantly increases the risk of cardiovascular diseases, kidney failure, and stroke. While antihypertensive medications remain a primary treatment, they often come with side effects and adherence challenges. This is why non-pharmacological strategies like exercise have gained attention. Regular physical activity enhances vascular function, regulates autonomic balance, and reduces inflammation, mechanisms that can contribute to lowering blood pressure. In this review, we sought to determine the effect of exercise on blood pressure in hypertensive adults.
Exercise is a cornerstone of hypertension management, combining aerobic, resistance, and isometric training. It helps reduce blood pressure and boost cardiovascular health, while complementing pharmacological treatments for better overall outcomes. Using the PICO framework, we formulated our research question. We compared exercise interventions, such as aerobic or resistance training, against no exercise or usual care, focusing on outcomes like blood pressure reduction, quality of life, and adverse events.
Our research question is, what is the effect of exercise interventions on blood pressure in adults with hypertension compared to no exercise or usual care? To ensure the credibility and reliability of our findings, we employed a comprehensive and systematic approach. Our search strategy was meticulously designed, spanning multiple prominent electronic databases, including PubMed, Cochrane Library, Scopus, and Google Scholar. We used a combination of keywords and controlled vocabulary to capture all relevant studies. Our inclusion criteria were stringent, focusing on randomized controlled trials published within the last decade and requiring studies to define hypertension using established guidelines. We specifically looked at the effects of aerobic, resistance, and isometric exercise on adults with diagnosed hypertension. Our primary outcome measures were changed in systolic and systolic blood pressure, while secondary outcomes included endothelial function and blood pressure variability. To maintain rigor, we applied strict exclusion criteria such as excluding non-randomized studies and studies with confounding coexisting conditions.
Our literature selection process adhered to the PRISMA guidelines, and we used the Joanna Briggs Institute Critical Appraisal Checklist to assess the methodological qualities of each study. Finally, we performed a meta-analysis to calculate pooled effects and assessed heterogeneity using the I-squared statistic, providing a robust and transparent synthesis of the available evidence. The visuals of these slides help to show the processes that were used.
In our analysis, we included a diverse group of 67,627 participants from 10 different studies. This sample represented a broad range of ages, genders, and ethnicities, as well as individuals with mild to moderate hypertension and those with higher cardiovascular risks. The study's global representation helped make the findings more applicable to various populations. As for the exercise modalities, we looked at aerobic exercises such as walking, running, and cycling, which are great for boosting cardiovascular endurance. We also included resistance training, both dynamic, like weightlifting, and isometric, which involves static muscle contractions like wall sits. These exercises varied in frequency, intensity, and duration, reflecting real-life exercise routines people follow. Here we present the data extraction table for the 10 studies included in our meta-analysis. This table summarizes key details such as the study design, participant characteristics, types of exercise, and the outcomes measured. It allows us to compare the methodologies and results across the different studies in a clear and organized way. By extracting this data, we ensure consistency and transparency in the way we evaluated the effects of exercise on hypertension, helping us draw more reliable and accurate conclusions.
In our analysis, we found that exercise resulted in a mean reduction in systolic blood pressure from negative 3.5 millimeters of mercury to negative 10.9 millimeters of mercury, with similar reductions in diastolic pressure ranging from negative 2.5 millimeters of mercury to negative 6.2 millimeters of mercury. These findings were consistent across all studies, suggesting that exercise is an effective intervention for managing blood pressure, regardless of the type of exercise or participant demographics. We observed that different types of exercise had varying effects on blood pressure. Aerobic exercise like walking and cycling were effective in reducing both systolic and diastolic blood pressure. Resistance training also showed significant improvements, but isometric exercise, such as wall sits, resulted in the largest reduction in systolic blood pressure. However, it is important to note that variability in exercise protocols and participant characteristics calls for caution when interpreting these results.
In addition to reducing blood pressure, exercise offers several cardiovascular benefits. It improves endothelial function, which is crucial for maintaining healthy blood vessels. Regular physical activity also stabilizes blood pressure, reducing variability and lowering the risk of hypertensive crisis. Furthermore, exercise improves vascular health by reducing arterial stiffness, which is vital in preventing cardiovascular disease. Exercise is an effective way to lower blood pressure, although its effects are generally smaller compared to those of antihypertensive medications. Some studies have compared exercise directly with medication, and while exercise alone may not match the blood pressure lowering power of medications, it offers additional benefits such as improved physical fitness, weight management, and better glucose control. These benefits make exercise an important complement to medication in managing hypertension.
One of the challenges in interpreting our findings is the heterogeneity among the studies. Participants varied widely in terms of age, baseline blood pressure, and other cardiovascular risk factors, which may have influenced how they respond to the exercise. Additionally, differences in exercise protocols, such as frequency, intensity, and duration, contributes to the variability in results. Some study issues, such as small sample sizes and inconsistent control groups, also affect the reliability of our findings. Exercise should be integrated into a broader, multimodal approach to hypertension management. It should be combined with dietary modifications, weight management, and stress reduction strategies. Exercise is most effective when viewed as a long-term lifestyle change, not a short-term fix. For some individuals, medication may still be necessary, but exercise can enhance the effectiveness of pharmacological treatments.
To build on our findings, future research should focus on long-term studies that evaluate the sustained impact of exercise on blood pressure and overall cardiovascular health. Researchers should also improve the reporting of exercise-related adverse events to ensure safety in diverse populations. Additionally, more research is needed to assess the impact of exercise on the quality of life in people with hypertension and to optimize exercise prescriptions based on individual needs. In conclusion, exercise significantly reduces blood pressure with structured and individualized programs yielding the greatest benefits. As we move forward, research should focus on standardizing exercise protocols to improve comparability across studies. Healthcare providers must play an active role in promoting exercise as a first-line intervention for managing hypertension.
Based on our findings, we recommend that patients with hypertension engage in at least 150 minutes of moderate intensity aerobic exercise per week. Additionally, resistance training 2 to 3 times a week, and incorporating short duration isometric exercises like wall sits can further help lowering blood pressure. But most importantly, exercise should be integrated into a patient's daily routine for lasting health benefits. These are the references we used in formulating our research. We really enjoyed working on this project. Thank you so much.